Hi, I'm Dr. Emily Ray. I'm a wound care physician at the Hamilton Wound Care and Hyperbaric Center. I'm married to my husband, who's a general surgeon, and I have two little ones, a 20-month-old little girl and a 4.5-year-old little boy. When my husband had decided to do fellowship, I had to start searching for jobs, and I didn't really want to go back to the emergency room. And so I looked for wound care opportunities in Tennessee and Georgia, and Hamilton popped up. I knew nothing about Dalton or the surrounding area. And when I came to visit, everybody was incredibly friendly. There was such, I guess, Southern hospitality, just so much enthusiasm about wound care. I just felt like I fit in. I went to Michigan State University for undergraduate and had a degree in human biology, and then went to Michigan State for medical school. After that, I did my training at Pontiac Osteopathic Hospital, and did my training in ER there for 4 years. And after that, I worked 1 year in Detroit at a larger community hospital, and then moved to New Hampshire. Worked there in the emergency room at 2 different ERs, and there was a need for wound care in the area, and the vascular surgeons needed someone as an adjunct to them, and I was offered a position and did a lot of extra training, have 2 certifications in wound care that are physician specific, and then I have my introductory course to hyperbarics, and then I did something called a PATH course, which is extra training in hyperbaric medicine that gives you a lot more experience with it and allows you to treat patients more effectively and with a more evidence-based approach, I believe. So when I'm not working, I enjoy just being outside. We used to live on a lake, so we did all the water sports you can imagine. Used to take my son out in a canoe and have lunch out on the canoe. And then hiking, biking, running. Yeah, I'm pretty much up for anything. My grandfather, my uncle, my dad are all family practice doctors. My father set me up with a lot of different physicians to shadow, and then I ended up really falling in love with it. As I did more and more shifts in ER and more years with ER, I really enjoyed the time that I spent with families and the time that I was able to spend with the really sick patients and the patients who needed us the most. And that led me to explore other options. And wound care was one of those that I was able to have significant continuity and see my patients improve and get to know them and really form a bond that made a difference that was meaningful to me. And I feel like wound care is one of those specialties that people either like or they don't. I get very excited about wound care, and I think it's a field that people don't realize it exists until they need it, and that it affects patients' lives more than they know. So that was something that really made me want to learn more about it and be part of it. When patients see improvement in their wounds, and just the joy and the happiness because they felt so defeated by the whole experience. And if I can give them some hope and happiness out of it, it just makes me happy. And if we can help heal that it gives them so much confidence and they can live their life. And I think that's the biggest part of why I feel so great doing it.